Well, first of all, I was very impressed. And one of the difficulties in modern medicine is trying to assimilate all the information because there's lots of different tests coming in, there's the blood pressure, the pulse. And I think the beauty of the product, especially in an intensive care situation, is that it will allow the physician or the nurse or the caregiver to almost like at a glance get an idea of, well, is there a deterioration, is there an improvement, and also to change parameters. For example, if the PO2 is too low, the oxygen can be increased. I think it's very, very interesting and an excellent innovation. I mean, I think that is also incredible. It is like ahead of its time. It's certainly not something that is available to most of us, and I hadn't even heard of it, but I'm sure there are many patients who would really appreciate that. So again, very impressed. One is in the video games, and I think we have a generation of children who will become young doctors, who become students. Exactly, the digital generation, and they're used to doing that. And I think that it's a better way of learning. The students will be able to grasp concepts more easily, and also it's fun. So it will make learning fun for them, and I definitely think it will enhance their learning experience. They say a picture is worth 1,000 words, and maybe a video game is worth 1,000 pictures. So one advantage that I think you highlighted, and I agree with, is that because you can monitor the patient remotely, for example, with the automated stethoscope, and we all know that if you actually had to go and see a patient, donning the PPE, your gloves and everything like that takes time. And so this is a way, I think, to get a quick assessment of the patient, maybe remotely. And maybe you will need to go to the patient eventually, but I think it's a good way to do that. Exactly. So I think it's fantastic. And yeah, again, very impressed. It links very well with the live monitoring board, so really great. I like the PPA game, and during, the reason is, because during COVID, I was on the general medical wards, and then I was trying to think, now, what do I do first? And so having the step-by-step guide, I wish I'd had that in my app so that I didn't get it wrong. So that was really good. I think the taking blood game is good, and the mannequin where you can, I don't know, do CPR or aspirate a pleural effusion, fantastic, really a great innovation, I would say. Thank you. It's been a pleasure talking to you, and a pleasure having all of the demonstrations.